Facial volume replacement. One of the things that's relatively new, I would say, over the last 15 years when we describe how the face changes with aging, is the fact that faces that age lose volume. And it used to be, as you aged, you would get a facelift and the facial skin would get pulled tight and people would look somewhat peculiar and operated on, or at least not younger. Maybe better, but not necessarily younger. What ends up happening with aging is that gravity brings everything straight down to the ground. So gravity causes jowls to form, neck skin to sag, mid-facial fat to droop, and there's also loss of fat volume in the face. And it's the replenishment, especially in aerobic exercisers that run a lot, adding some volume to the face is extremely youthening, and I'm going to show some examples of that. This is one of my patients I injected back in 2004. He has an indentation in the cheek over here and over here. After 2 treatments, you can see that the right cheek is completely corrected, and there's still a very slight indentation, a mild undercorrection in the left cheek. I had the opportunity to photograph him in 2011, and you can see that the right cheek remains completely corrected. The left cheek is slightly undercorrected, and this demonstrates not only the permanency of liquid injectable silicone, but the fact that when it's administered with the microdroplet serial puncture technique, silicone does not migrate out of the treated area in my experience. This is a young patient who obviously doesn't have facial aging, but she has obvious lower eyelid bags that are displeasing. And I'm going to comment that her midface, or the distance from her cheekbone to her cheekbone, is somewhat narrow. So the first treatment I did was to deal with the bags. I put some silicone underneath the bags on 2 occasions to diminish their appearance. And then I did 2 treatments to her high cheekbones over here and over here to get expansion of the midface. Because expansion of the midface changes an oval appearing face into a more heart-shaped face where the cheeks are full and it tapers down to a nice pointy chin without any jowls. A heart-shaped face is an attractive, youthful face, and that's what I look to do when I'm analyzing a face and making recommendations about replacing lost facial volume. This is one of my male patients. Again, very flat appearance in the midface and very prominent lower eyelid bags. Instead of taking the bags out, volume was replaced under the bags and into the midface over here. And you can see that there's a youthful, more pleasing appearance on the right where the lid bags are less prominent and the patient looks younger and better.